Hi, I'm Dr. M. Sheldon Polsky, MD, the Medical Director for the Yale Clinic. As a board-certified urologist with more than 40 years of practice experience, I've seen thousands of men who suffered from erectile dysfunction. I know just how devastating this can be for men of any age and the impact it has on their lives and relationships. Getting medical treatment for erectile dysfunction is important, but it's also very difficult. Many of my patients have been embarrassed and tell me that they feel defeated and like less of a man. They're worried about themselves and their marriages or relationships, and going to the doctor is often their last resort. They've already tried the little blue pill and other popular drugs only to find that they didn't work or they stopped working altogether. I'm a retired medical corps colonel in the United States Army and Air Force with 28 years of private practice experience. I was also a clinical professor of urology at a major medical center. My patients have been men of all ages and from all walks of life. Erectile dysfunction can afflict young adults or the elderly. It doesn't matter if you're a soldier, a construction worker, a white-collar executive, or a retired grandfather. Let me assure you, erectile dysfunction doesn't discriminate. I also assure you that it does not indicate a loss of masculinity. You see, erectile dysfunction, what is often referred to as ED, is a medical problem. In fact, most of the time, it is caused by medical issues such as diabetes, radical prostate surgery, or cardiovascular diseases, as well as other medical conditions and the medications that are used to treat them. Thanks to modern medicine, most of these conditions are treatable today, and thankfully, so is ED. Advances in medicine have given doctors like me new ways to effectively treat ED, safe treatments that don't require surgery, effective treatments that work better than popular drugs and without the risk of their dangerous side effects. And above all, we found that there is a treatment that works for nearly every man, no matter how old he is or what medical conditions he may have. Now, years ago, our options were limited. Traditional treatments included popular drugs and other conventional methods like vacuum erection devices. When those didn't work, our patients had basically two options: resort to surgical implantation of a penile prosthesis, or resign themselves to a life without sex. As a doctor, I always hoped that one day we could find a safer, more reliable treatment. And the good news is we have. The Yale treatment is very exciting and a tremendous breakthrough in treating ED. Like I said, it works for nearly every man, every time. Not only does it give men back the ability to perform, but it also brings back their self-esteem and manhood. It's brought intimacy and love back into their relationships and marriages, and it's safer than the popular drugs. If our treatment is so great, and it is, why haven't you heard about it? That's a good question, and the reason I wrote 7 secrets that doctors and drug companies don't want you to know about erectile dysfunction. And I wrote it because I think you deserve to know about erectile dysfunction treatment that really works, one that works immediately and with minimal side effects, if any. And we know that it will work for nearly every man because we use FDA-approved medications and custom blend them based on each man's needs and how long he wants his erection to last. Yes, you get to choose. That is the treatment we offer at the Yale Clinic. Don't wait any longer. You're just a phone call away from regaining your sex life. You can be assured that your call will be completely confidential. In fact, you have absolutely nothing to lose. If you don't respond to our treatment in the office on your very first visit, there's no charge. We've removed all of the risks because I believe every man deserves to have a satisfying sex life. You owe it to yourself and your partner to call the Yale Clinic today.